name is Cliff Robinson. I'm a radiation oncologist at Washington University in St. Louis. When patients come in and they're thinking about getting their radiation treatment, they often wonder, what is it going to feel like to get radiation? What's it going to feel like when I'm actually there in the treatment room? And the answer is that for most patients, they feel absolutely nothing. For the delivery of the actual radiation itself, and it really doesn't matter whether it's an X-ray or a proton or some other type of radiation treatment that your doctor may prescribe. If you're getting a type of radiation called external beam radiation, where the radiation comes from outside and is delivered inside using a specialized machine called a linear accelerator, you're not going to feel anything during the actual treatment itself. The treatments are invisible. You don't see it, you don't hear it, you don't smell it. There are no lights or lasers that are produced because of this radiation treatment. There are different lights and other lasers in the room itself, which can be used to align you, or they can be used to help make sure that we're on the right target. But the treatment itself is not something that you can appreciate. There are rare exceptions to this rule. Sometimes when we treat the brain, people will notice funny smells or flashing lights. And that's just a trick as the radiation goes through the brain and activates some of the neurons in that area. But for most patients, they're not going to notice anything at all. It's a very open room too. So for the overwhelming majority of patients who might be worried about being claustrophobic or being in a tight space like you might have if you go into an MRI or a CT scanner, most machines are very open. We try to make it as inviting as possible. Most centers across the country will try and give you a blanket, give you some warmth if you're feeling a little chilly in there. Oftentimes we make it cool for the machine, which isn't always so good for you. So we'll give you a nice warm blanket if necessary. And in many places, we'll try and pipe in some music if that's what you want to listen to. A lot of patients feel a little bit more calm if they have some music playing at the same time as the treatment, something to kind of center themselves. So as you lay there for the treatment, it would be exceptionally uncommon to notice anything at all. I actually describe it for most patients as one of the more boring things that you'll do during the day. And I think that for many patients, that's a welcome departure from many of the things that have been kind of stressful leading up to those treatments.